Bronchitis is an inflammation of the mucous membranes of the tracheobronchial tree, the airways that carry air to and from the lungs. Usually results from an upper respiratory infection that causes inflammation, swelling, and mucus production on the bronchioles.
There are two classifications of bronchitis: acute bronchitis and chronic bronchitis. Acute bronchitis is the most common form of bronchitis, and it's usually the outcome of an upper respiratory infection caused mainly by a virus, but sometimes it can be caused by bacteria. Chronic bronchitis is not as common, and it's usually caused by irritants, such as air pollution and smoking. Acute bronchitis can last up to 10 days, and if symptoms persist after 90 days of the year, after 2 consecutive years, it is then classified as chronic bronchitis. Both have the same physiological effects on the body, and both can be caused by irritants.
Risk factors. The same viruses that cause cold and the flu often cause acute bronchitis. These viruses spread through the air when people cough or through physical contact. Less often bacteria can cause acute bronchitis. Elderly people, infants, and young children are at higher risk for acute bronchitis than people in other age groups. Permanent moderate exposure to tobacco smoke, air pollution, dust, and different vapors are associated to chronic bronchitis. It also frequently affects people who suffer from allergies, other respiratory illnesses, chronic sinusitis, and infected adenoids.
The normal structures of the respiratory system affected by bronchitis consist of the trachea and the bronchial tubes. The tissue layers of the trachea and bronchi are made up of pseudostratified epithelium. The epithelial layer contains cilia as well as goblet cells which secrete mucus. The mucus secretions trap foreign bodies, and the cilia sweeps the debris to be eliminated from the respiratory tract. When air enters into the respiratory tract, the bronchial tubes branch and eventually the air reaches the alveoli. This is where a gas exchange occurs. Oxygen enters the alveoli where it gets diffused into the bloodstream by simple diffusion. Simultaneously, carbon dioxide diffuses out of the bloodstream and into the alveoli where it exits the respiratory tract through expiration.
Symptoms: runny and stuffy nose, starting a few days before the chest congestion due to respiratory infection that usually starts in the nose or throat and travels to the bronchial tubes. Fever, feeling tired because of the inflammation and hypoventilation. Wheezing or whistling sound while breathing is due to the inflammation that causes less air to be able to move through the bronchial tubes as they are narrowed. Coughing up mucus that may be yellow or green. Mucus hypersecretion associated with hypertrophy of the submucosal glands in the trachea and bronchi. Chest tightness and shortness of breath are also related to causes mentioned above. Sore ribs from prolonged periods of coughing. Fatigue and shortness of breath also are related to hypoventilation and a shift in the body's pH balance.
When bronchitis develops, an infection or irritant present triggers an inflammatory response which causes a change in the epithelial lining of the bronchi. The process of inflammation begins with the release of inflammatory chemicals and leukocytosis-inducing factors. Histamine, that is released by mast cells, is an important inflammatory chemical that plays a role in an increased capillary permeability, dilation of the arterioles, and also attracts neutrophils, monocytes, and lymphocytes to the area. These perform phagocytosis and chemotaxis. The release of leukocytosis-inducing factors causes leukocytes to migrate to the affected area of the bronchial tube, cling and pass through the capillary walls, and undergo phagocytosis in the bronchial tube. When an inflammatory response is triggered, there becomes an increase in the number of goblet cells present, which results in hypersecretion of mucus. The excess mucus present damages the cilia so it cannot effectively sweep the mucus to flush it out of the bronchial tubes. As a result, the mucus builds up and there becomes a narrowing of the air passageway. When this occurs, an individual cannot successfully perform gas exchange as there is less oxygen able to enter the narrowed lumen of the bronchioles, and therefore less carbon dioxide is able to be expired. When a person has bronchitis, they have a reduced peak expiratory flow rate, which is an individual's maximum speed of expiration.
Acute infections and inflammation of lungs and bronchial tissues and pulmonary edema, which are presented while bronchitis, cause acute respiratory acidosis. The hypoventilation inhibits the excretion of carbon dioxide, which consequently combines with water in the body to produce carbonic acid, causes a shift in the body's pH balance and the body's fluids to become more acidic. It is evident that the pH and the concentration of hydrogen ions are strictly determined by the bicarbonate ratio rather than their individual values.
Key concept summary. Cell membrane is the location of simple diffusion gas exchange in the alveoli. Proteins are involved in the inflammatory process, such as histamine. Homeostasis is the shift of pH causing acidosis and results in hypoventilation.